A lot of people have asked, how am I treating Crohn's and Crohn's symptoms? Basically, there's an area of your spine, a large area of your spine, from T5 to L2, that has innervations to your intestines, your GI system. Anywhere along this area, if you have pressure on the nerves, it can diminish, delay the signal that's getting to the intestines, to the stomach, and cause problems. Problems in those areas present exactly like Crohn's: gas, bloating, nausea, pain, diarrhea, constipation, and other symptoms, including inflammation. So what happens is that when you go to your doctor and you say you have these symptoms, you'll get misdiagnosed, but it could be a problem in your spine. A problem because your spine is putting pressure on these nerves, diminishing the signal. So when you come to me, first I map out your symptoms, and not just your GI symptoms, all of your symptoms, your orthopedic symptoms, your hip, your knee, anything in your body, because it's all interconnected. Then we take a look at your spine and we see if there's an area of your spine that's stiff or tender. And if this area could explain your symptoms, I show you how to treat it. And most importantly, I show you how to mobilize it at home. I show you how to strengthen in that range at home, because that's what keeps pressure off this nerve. Not what somebody else does to you, but what you're able to do day in, day out to actually keep yourself better. Once you take pressure off of these nerves, now you've restored that nerve signal. Now your intestines can work properly. Now your stomach can work properly. And also too, we'll see improvements in your non-GI symptoms. So your joints, we should see improvements in your hip or your leg pain that presented. And we monitor this over the course of a few weeks, making sure that you're on the right track. Typically, the thoracic area needs to extend to take pressure off of the nerves from you doing this all day long. Typically, the lumbar spine needs to flex because you've been stuck in that ass out position. It's pretty simple. I just show you how to take pressure off the nerves, restore that nerve signal to your intestines, to your stomach, and then we see your symptoms change over time. It's not complicated, but it does take some work, and it takes more work than just taking a pill, and it takes more work explaining it than just saying that you have this diagnosis that you very likely don't have. So if you want something different, if you want to see if there's a different approach that actually treats the underlying cause, that's what the Spinal Truth does.